Hello friends. Today I am going to teach you regarding one very important topic as far as exam point of view and the practical point of view, that is the wound healing and the factors affecting the wound healing. Myself Dr. Parth Goswami, I am consultant pathologist and I will teach you about the wound healing. First of all, I request you to see the video in the high quality. You can change the setting in the YouTube and see the video in the highest quality so that the quality of image will not get hampered. So basically, how do the wounds heal? Suppose you have the wound, then how it heals? That is our main motive to learn, and we will understand the pathogenesis basic, that how wound healing happens. So before I start regarding the wound healing, you should be familiar with the some terminology. Means you should be familiar with the resolution of, you should be familiar with the fate of inflammation, that what happen when you are having the inflammation. Okay, so basically there are three events in the inflammation. There can be resolution, there can be regeneration, or there can be repair. So wound healing is basically a repair mechanism. It is not the resolution or regeneration. So what do you mean by resolution? So suppose you are having the wound over the forearm, you are having the minor inflammation, or you are having common cold infection, right? Suppose you are having the common cold. So what will happen? There will be recruitment of the acute inflammatory cell like that of neutrophil and later on macrophage that will try to do the phagocytosis, right? And after their function is over, there is a clearance of the inflammation. So that is the ideal outcome, just clearance of inflammation, no damage will happen. That is the resolution and it is the best outcome seen in the minor inflammation. Okay, second terminology is regeneration. So basically, regeneration means a renewal or restoration of the lost tissue, either renewal or restoration of the lost tissue, right? So if so lost parenchymal cells will be replaced by division of the adjacent parenchymal cell. So this regenerative process happens in bacteria as well as in human. Suppose we are removing the part of liver, then what happened? We have removed the particular parenchymal cells so that the remaining adjacent parenchymal cell will proliferate to compensate this loss. So suppose one person is lost, then it will be replaced by regeneration by the adjacent parenchymal cell, division of adjacent parenchymal cell, that is called as regeneration, and so there will be complete restoration of the normal tissue. Now we will see what is repair. Suppose this is your, okay, suppose this is your skin epidermis, right? This is your epidermis and below it there is a dermis. Suppose if you are having the wound here, a major wound, right? If there is a defect, breach in the continuity of epidermis, then this damaged tissue cannot able to do the resolution or regeneration. What will happen? There will be replacement of the damaged tissue by the fibrocollagenous tissue. So in the simple word, we can say that we are filling the defect with the fibrosis, right? Because of wound here the gap is formed, so that will be filled by fibrotic process. It will be replaced by fibrocollagenous tissue, and that is the wound healing and that is the repair mechanism. So basically wound healing is dealing with the chronic inflammation. It's an example of usually chronic inflammation. Acute inflammation will also happen, but the major event is because of chronic inflammation. Okay, so which are the basic methods of this cutaneous wound healing? Right, suppose you are having the wound, then it can heal. As we have discussed, it is replaced by fibrous tissue. There will be fibrosis, but that union, that repair can happen in two way. Either it can be primary or it can be secondary union, right? So what is that? Just remember, we always want the healing in the primary way. We always want the wound healing in a first intention. So what is first intention? Suppose this is your skin, right? and you are having the breach in the continuity, you are having the wound here, but it is the clean wound. It is the clean wound. The gap is very small, the defect is very small, it's an uninfected wound, and you are taking the suture here, then such best healing is known by the name primary union. Clear? Small, clean, uninfected wound, sutured wound will heal by the primary intention. That is called as primary union. So we are taking the surgical incision to oppose this edge. Clear? You can take the suture here because the wound is not infected. If it is infected, then you cannot take the suture. And such large wound, suppose you are having the very large wound, right? And it is heavily infected by the bacteria, then such wound cannot be sutured. So such infected large wound with the maximum loss of tissue will heal by the secondary intention. And what is the disadvantage of this secondary intention? Why we don't want to heal it by a secondary intention? That is because in the secondary intention, in the secondary union of wound healing, there will be more inflammation, and so you can easily understand there will be more granulation tissue, and there will be more fibrosis, and more scar will develop. We will understand in the detail, but this is the basic. In the secondary union, there will be more granulation tissue and more scar, and that's why it look very ugly. The healing by the secondary union will look cosmetically ugly, and most importantly, it is contracted wound, so it is the less functional. I mean, it cannot function properly. That affected area will be less functional. So we don't want healing by a secondary union. The primary union is the best way of healing, but this is the two way of the healing. Okay, now you have to remember that in the secondary union there will be wound contraction that will not occur in the primary union of healing. The wound contraction is always the feature of secondary union. That is the most important MCQ. Clear? Okay, and now you have to remember the process of wound healing in a three phase. We will understand that in which mechanism, in which phase the wound will heal, right? Either primary way or secondary way, but which are the phase? So you have to remember that basically there is a three step of the wound healing. The first step is obviously an inflammation. Whenever you are having the damage in any site of body, first of all there will be inflammation, and again in the detail, first of all there will be acute inflammation, and gradually it will be replaced by chronic inflammation. If you are not treating the acute inflammation, then it can get converted into chronic inflammation. Second event is there will be formation of granulation tissue and the reepithelization. Suppose this is your wound, right? Then approximation of this defect is by the process of reepithelization, and the epidermis will be restored. So that is reepithelization. We will understand what is granulation tissue. Usually granulation tissue is more in secondary union, right? The granulation tissue is more in secondary union, it is very less in primary union. Third event is wound contraction because of extracellular matrix deposition, and there will be remodeling. We will understand all this step in the detail. This wound contraction is particular feature of secondary inflammation. In the primary intention it is very less, but in the secondary union the wound contraction is maximum. So remember this master sentence, that wound healing is a fibroproliferative response. It is the replacement of the damaged tissue by the fibroconnective tissue. It is the fibroproliferative response, nothing else. So these are the three steps of wound healing. We will understand it in a detail. Okay. So here, this is the example of the healing by the primary intention. You can see that the wound defect is very small, right? This defect is very small, Now, first of all, what happen? If you are having the defect, the blood will accumulate there, and the platelet and the activated coagulation system will stop the bleeding, and that dried blood is known by the name scab. Such thrombus that is formed here is known by the dried blood clot that is known by the name scab. It is nothing, is the dried blood clot. Clear? To stop the bleeding. So first of all, there will be formation of scab. Okay. In the first 24 hours of the wound defect, you already know that in the first 24 hours, the inflammatory cell will always be acute inflammatory cell, and the neutrophil is a classic example of such acute inflammatory cell. So first of all, in the 24 hour there will be neutrophil recruitment, and you can able to see the blood clot, or we can say the scab. Clear? So this is the event in the 24 hours. Nothing else will happen. This neutrophil will do the function of phagocytosis. But later on, what happened? After 3 to 7 days of the wound, such neutrophils will be replaced by chronic inflammatory cell. So your neutrophils will be replaced by macrophage. So after 3 to 7 days, the main inflammatory cells will be macrophage, and this macrophage is responsible mainly for the fibrosis by elaboration of the fibroblast growth factor and the transforming growth factor beta. Okay, now what happened? You are having the chronic inflammation after 3 to 7 days, right? Additionally, what happened? The fibroblast will be activated to do the fibrosis. That is because of the elaboration of the transforming growth factor beta and because of platelet derived growth factor. Another cytokine that is responsible for fibrosis is fibroblast growth factor. So these three basically will lead to activation of the fibroblast, and there will be fibrosis. Okay, again you have to remember that there is elaboration one important growth factor, that is the vascular endothelial growth factor, and it will form the new blood vessel. It will form the new blood vessel. Clear? So after 3 to 7 days there will be more fibrosis. That is because of platelet derived growth factor, fibroblast growth factor, and transforming growth factor beta. So there will be fibrosis, plus because of vascular endothelial growth factor there will be new blood vessel formation, right? So these two combined process is known by the name granulation tissue. Granulation tissue is a nothing, it is the newly formed blood vessel and the fibrosis that is known by the name granulation tissue. This granulation tissue, you can see that it is very less here because it is the healing by the primary intention. Clear? And gradually within few weeks there will be complete restoration of the epidermis. You can see the epidermis is completely restored, and there is a less scar. Clear? But now I will show you the figure of secondary union. Just see here how it looks. It's a very infected large wound. You cannot take suture here because it is the infected wound. So here you can see the blood clot. Clear? This is the blood clot, or we can say scab. Now what happened? Just see, after 3 to 7 days there is abundant granulation tissue in the secondary intention. Just compare the figure. Here the granulation tissue is less, but see here the granulation tissue is much high. Clear? And you can able to see many inflammatory cells. Here there are recruitment of many macrophage, chronic inflammatory cell, right? So in the secondary intention there will be more granulation tissue, right? And there will be more inflammation, right? So in that way you can differentiate it from primary intention healing, right? Here granulation tissue is more, there will be more inflammation. Obviously because of more granulation tissue there will be more fibrosis, right? So it will form a large scar. In the secondary intention there will be large scar formation. you can able to see the large scar here, right? The wound that is healed by secondary intention will form a large scar, and cosmetically it looks ugly, as well it is less functional. Clear? So that is a basically basic mechanism of the primary and secondary healing. Okay, so this is some example of why fibroblast proliferation will happen. As we have discussed, the fibrosis is because of elaboration of certain growth factors, that is platelet derived growth factor, epidermal growth factor, fibroblast growth factor, and transforming growth factor beta. And angiogenesis is basically because of vascular endothelial growth factor. Guys, name itself suggests this fibroblast growth factor, transforming growth factor beta, all having the function of fibrosis. And vascular growth factor means name itself suggests it is having the function of angiogenesis. It is the most important MCQ. You have to remember that, guys. Right? Okay. So as of now, you can basically understand that the central of the wound healing is the granulation tissue formation. So we can say that granulation tissue formation is the hallmark of the wound healing. It's the main event of the wound healing. What is granulation tissue? It is a proliferated blood vessel because of vascular endothelial growth factor and proliferated fibroblast. That is because of transforming growth factor beta mainly. So these two process of newly formed blood vessel and the proliferated fibroblast is known by the name granulation tissue. Don't ever forget it. The granulation tissue is newly formed blood vessel and the fibrosis, right? And the granulation tissue is suggestive of non-specific inflammation. It is not specific, it is suggestive of chronic inflammation, right? So the granulation tissue will form in the wound healing, and it is the example of chronic inflammation. So here you can see there are proliferated vessels. You can see that many newly formed blood vessel is seen, right? These all are the blood vessel. It contains the RBC within it. That's why it is blood vessel. You can able to see it red colored. It is the endothelial line structure, right? RBC, the blood vessel looks in that way. It is endothelial line structure, and inner it there is a red blood cells. All these are blood vessels, and in between the proliferated blood vessel there is a presence of pink colored fibrosis, right? So this is the example of granulation tissue, fibrosis plus newly formed blood vessel. Okay, so I have made it simplify. This is the day wise features of the wound healing, right? Immediately, whenever, whether it is primary or secondary intention healing, whenever you are having wound, immediately there will be clot formation by the platelet and activated coagulation system. The coagulation system will form the fibrin. You already know that. So it will form the clot. So immediately clot will form to stop the bleeding. In the day 1 up to 24 hour, there will be maximum number of neutrophils. So along with clot, you can able to see the neutrophils, right? Day 3, the neutrophils start getting replaced by chronic inflammatory cell, that is macrophage, and the granulation tissue will start form. It is not maximum, but it will start forming. So there will be slight collagen deposition, but there is a no bridging of gap because the collagen tissue is not much enough to bridge the gap. The gap will gradually fill by the day 5. There will be more granulation tissue, maximum granulation tissue, and so the maximum fibrosis will fill the incision gap, and there is a complete epidermal thickness recovery. So by the day 5, your wound will start getting healed properly, right? And in the day 14, after approximately 2 weeks, neutrophil is not at all seen, right? It is completely replaced by fibrotic tissue. There will be maximum collagen. So after 2 weeks, there will be only collagen tissue. There will be only fibrosis. And after the date, and after the 28th day, after 28th day, right, the scarring is totally complete. Usually what happens in this granulation tissue, the fibrosis is means collagen tissue is the type 3 mainly. Type 3 collagen will be the predominant component, but after the 1 month there the predominant component will be type 1 collagen. It will replace the type 3 collagen. That is most important MCQ. Clear? So that is the day wise event that is happening in the wound healing. You can see here, just see, in the day 1 to day 3 a neutrophil is a predominant cell, right? All these are neutrophil. Neutrophil looks like this. It is a trilobed structure, right? But after 3 to 7 days you can see these neutrophils are start getting replaced by macrophage, and there will be formation of granulation tissue. So after 3 to 7 days the event is totally different. Within the 1 week it try to heal completely, right? So that is the day wise event. Okay, now you have to remember that in the secondary intention, in the healing by secondary intention, there will be scar formation, right? So what happened additionally in this secondary intention? Additionally, what is happening in the secondary intention? The fibroblast is getting converted into myofibroblast, right? It is getting converted into myofibroblast. So what do we mean by myofibroblast? See, basically fibroblast doesn't having the function of contraction. In the body the function of contraction is done by the muscle cells, right? But here what happened, the fibroblast getting the superpower of getting contracted, right? This fibroblast will start getting contracted. That's why it is given the name myofibroblast. So it will contract. So there will be wound contracture in the secondary healing. What happened? Wound contracture, and that is because of myofibroblast. It is the modified fibroblast having the function of smooth muscle. It is having the smooth muscle property, right? It is having the function of smooth muscle. So it will acquire the smooth muscle property, and this myofibroblast is responsible for wound contraction, right? So in the secondary healing, the replacement of granulation tissue by the scar formation. In the primary healing also there will be scar formation, but it is less as compared to secondary intention. So the replacement of granulation tissue by scar formation is known by the important name that is known as tissue remodeling. Now you can understand what is tissue remodeling. The whole process of wound healing is known by the name tissue remodeling. Replacement of granulation tissue by gradually scar formation, that is remodeling, and it is mediated by matrix metalloproteinase. I will make another video for matrix metalloproteinase, right? You have to remember that zinc nutrient is required for the activity of matrix metalloproteinase. So the zinc is needed for wound contraction, right? Okay, now how wound strength will develop? After your wound is healed by the scar tissue, it need an acquirement of the strengthening. So the tensile strength of collagen is mediated by cross linking of the collagen, right? Tensile strength is mediated by cross linking of collagen, and such cross linking is mediated by the hydroxylation of the proline and lysine residues, and for that you need an vitamin C. That's why if you are taking the vitamin C, then wound healing can be faster, right? It can provide you the tensile strength immediately. So vitamin C is helpful in acquiring the tensile strength. This wound strength will gain start after the 7 days of injury. We have already seen that after 7 days, approximately 1 week, the gap will be replaced by fibrocollagenous tissue, by the scar. So you can say that wound strength will start gaining after 7 days. Now this wound strength will be 10% of the normal skin after the 1 week. That is very important, guys. Understand it, this one. What I mean to say, suppose this is your wound, right? It will heal by fibrosis, and this is your normal skin. So the tensile strength will be only 10% after the 1 week as compared to normal skin. And you might be surprised, guys, that Your damaged skin will never be like that of normal original tissue. The tensile strength will be maximum 70 to 80% after 3 months, right? After 3 to 4 months your tensile strength will be 70 to 80%. It will never reach 100% in your whole life. So once you get the wound, it will always remain as a wound. It will never be like that of normal tissue. That's why it is the repair mechanism. It is not the resolution or the regeneration, right? Now we will see which are the factors that will affecting all this wound healing process. It's very important to understand the factors, right? The factors can be local factor or it can be systemic, right? First we will understand local factors that will affect the wound healing. Okay, so suppose this is your wound and it is healed by the secondary intention because it is infected wound, so there will be more inflammatory cell, right? So the first factor affecting is infection. If your wound is infected, then it will heal by secondary intention, as you know. So the healing will be delayed, right? There will be more tissue injury, more inflammation, and some more scar will form. So the first factor that affect the wound healing is infection. Okay. Second factor is the mechanical stress. Suppose you are having the wound over the knee joint, right? And if you are doing the constant movement, then it will provide the mechanical stress and the wound healing is getting delayed. It can compress the blood vessel and it can separate the approximated wound edge, right? The approximated edge can be opened up. That is because of stress. It can compress the blood vessel as well. So the stress, mechanical stress, constant movement will delay your wound healing. Third factor, most important, foreign body. Guys, you might have seen that whenever you are having the wound, doctor first try to clean the wound. Why they want to make your wound clean? They want to make your wound clean to heal it by the primary intention. Because the dirty wound with a foreign particle within the wound or bone particle, that all foreign body particle can impair your wound healing. It can delay your wound healing. So the foreign body can delay the wound healing. Okay, fourth factor is type of wound. Obviously, primary intention healing will be faster and there will be less scar, right? And the secondary intention union healing is slow and it will form more scar, right? So the type of wound is the fourth factor affecting the wound healing. Obviously, the another factor is location of wound. Suppose you are having the wound over the foot, right? Then it will heal slowly. It will delay the wound healing. But if you are having the wound over the face, right? If you are having the wound healing over the face, then it will heal faster. So the location also will affect the wound healing process. Suppose your size of wound is very large, then it will heal by secondary intention, so the healing will be delayed, right? The size of wound is also one important factor. Suppose your wound is getting less blood supply or less nerve supply, right? The nerve is also get damaged or blood vessel is damaged, so that can delay your wound healing, right? Decreased blood supply and denervation can decrease your delay your wound healing. Suppose there is a large hematoma formation over the wound, then also it can delay the wound healing, right? Okay, so this is all about the local factors affecting the wound healing. Okay, now we will see which are the systemic factors that will affect your wound healing. So the first systemic factor is the age, right? If your age is advanced, then your wound healing will be slow. In the children, wound healing is faster, right? Second important factor is a nutrition. Okay, you already know that zinc is required for the activity of the matrix metalloproteinase and vitamin C is required for the tensile strength of collagen. So if you are having zinc and vitamin C deficiency, then your wound healing will be delayed. Diabetes will delay the wound healing because of affection of blood vessel, because of microangiopathy. Okay, if you are having the atherosclerosis or varicose vein in the blood vessels, then it can delay your wound healing because of angiopathy, right? Atherosclerosis and varicose vein can delay your wound healing. Okay, suppose your immunity is low. When your immunity will be low, if you are taking the immunosuppressant drug or if you are taking the steroid, then the inflammation will be less, so there will be less phagocytosis, right? The inflammation will not be more. Because of less inflammatory cell, less phagocytosis, and wound healing can be impaired. Secondary, the steroid and immunosuppressant drug can inhibit your collagen formation. It is anti-inflammatory drugs, so it will delay your wound healing. Obviously, the anemia will delay your wound healing. Okay, uremia can delay your wound healing. Obese patient having slow wound healing. If you are having the systemic infection, then your wound healing will be delayed. If you are having the malignancy, then also your wound healing will be delayed. So these are the systemic factors that will lead to wound healing. Okay. Okay, now we will see the pathological aspects of repair. If such wound healing or repair process is excessive, then it will lead to two basic pathology, that is the hypertrophic scar and the keloid, right? These two are the basic pathology of the repair, that is because of excessive repair. So this is the example of hypertrophic scar. You can able to see the scar tissue. In hypertrophic scar, the scar tissue will not grow beyond the boundary of the original wound, and it may regress spontaneously after a few months. Just see, this is the wound, right? This is the hypertrophic scar. It will not go beyond the boundary. And you can able to see microscopically the scar tissue of the collagen bundle is parallel to the skin surface. This is your skin surface and it is the parallel, right? The collagenous tissue is the parallel. So that is the peculiarity of the hypertrophic scar. You can do the spatial stain for the scar for the fibrosis. Remember guys, the spatial stain for the collagenous tissue is a Mason trichome stain in which your collagen will appear blue colored. Okay, what is keloid? Keloid is more dangerous than the hypertrophic scar because the keloid will grow. The scar tissue will extend beyond the boundary of the original wound and it does not regress spontaneously within months. Just see, this wound is going beyond the boundary, right? And you can able to see the haphazard arrangement of the collagen tissue. There is a dense collagenous tissue and it will arrange haphazardly. It is not parallel to the skin surface, right? And you can do the Mason trichome strain for confirmation. So that is regarding the keloid. Okay, now this is some golden points to remember, right, guys. Myofibroblast having the contractile property like that of smooth muscle, and that is a particular feature of healing by the secondary intention. Okay, early granulation tissue having both type 1 and type 3 collagen. Same is applicable in the liver cirrhosis as well. But you have to remember that whenever the scar is formed, the type 3 collagenous tissue is getting replaced by only type 1. So the adult skin, our normal skin and the scar formation having the type 1 collagen only. In most of the organ, the source of collagen is the fibroblast or we can say myofibroblast, except at one site where fibrosis occur because of activation of the stellate cell or ito cell, right? In the liver cirrhosis, the fibrosis is because of activation of these cells. Okay, now we will see some brainstorming MCQs of the wound healing. Okay, all the following statements are true regarding the keloid except it is due to excessive transforming growth factor beta, it extends beyond the wound margin, that is obviously true. No spontaneous regression, again true. Extended excision is the treatment of choice, that is wrong, right? This keloid is because of transforming growth factor beta. We already know that fibrosis is because of transforming growth factor beta, so the answer will be D. Okay. Second, myofibroblast is seen in wound margin, muscle septa, connective tissue, or bronchus. Obviously, it is seen in secondary intention wound healing, so it will be seen at the wound margin. Okay, wound contraction is mediated by, guys, This answer is very easy. The contraction is because of modified fibroblast, that is because of myofibroblast. So your answer will be myofibroblast. Okay, fibrosis is because of, as we have discussed, it is mainly due to transforming growth factor beta. Other factors are platelet derived growth factor, fibroblast growth factor, etc. Right? So your answer will be transforming growth factor beta. Okay, patient presented to you with trauma to the foot, and so the wound is developed. The stitch is taken within the 2 hours, at which time his wound will show the maximum proliferated and congested capillary. What I mean to ask you here is, when the capillaries are maximum, means when your granulation tissue will be maximum. So guys, remember that day wise table. The maximum granulation tissue will occur at 5 days, around 5 days. So your answer will be around the 5 days, right? After 5 days. So answer will be C, after 5 days. Okay, which is the hallmark of the wound healing by secondary union? As I have discussed, whether it is primary union or secondary union, the hallmark of the wound healing is always the granulation tissue formation. It is the hallmark of the wound healing, guys. So your answer will be granulation tissue. Okay guys, so that is all regarding basic regarding the wound healing and the factors affecting the wound healing. If you like my video, then you can comment in the comment box, right? If it needs an improvement, then you can also put and comment. I will try to upload as much video as I can. If you like my video, you can subscribe my channel and press the bell icon so that you can get notified whenever I am posting the new video. Okay, thank you very much guys. See you again in the next video.